All right, hello students. This is our first video taping of a skill, and I'm going to be putting that on a YouTube thing that I made for uploading videos and stuff. So hope this works out really well, and we'll see. Anyway, this skill that I'm going to show you, or this first video, is called IV Piggy Back. IV Piggy Back. And so what that is we have a primary IV currently running in our patient. And that may be a D5W, it may be a normal saline or something like that. And then what usually happens with patients when they're very sick or something like that, the doctor will order them to have a certain medication, and that'll be piggybacked into the primary solution. So what I'm going to do is just simply show you how to hook that IV piggyback, that secondary solution, into the primary solution. This is going to be gravity fed. The optimum thing is to use a pump. If you have the pump, you want to do that. But I'm going to show you how to gravity feed it, if that's possible for you to do that, and show you the ins and outs of that, safety stuff about that, so that you'll be familiar with how to do that. And so we'll just get started. So one thing that you got to have, obviously, is a secondary medication. And so usually the secondary medications come in a lot smaller bag. They're about 50 milliliters up to 100 milliliters, maybe 200 milliliters, like maybe a heparin or something like that, 250 milliliters or something. And so you got to have your medication. So you definitely want to do the 5 rights: the right patient, the right route, the right dose, the right time, and so forth. Right route. So you want to make sure that you get your do the 5 rights. Make sure you check the medication 3 times. You want to make sure that this medication is compatible with your primary solution. So we've kind of talked about that already with IV pushes, where we had to make sure that if we were doing a push into an IV line, a primary IV line, that the medication had to be compatible with the solution. And so this is exactly the same thing. We're going to be running this piggyback into the same line, primary line. And so they're going to mix together there for a little bit, and we got to make sure that they are compatible. So how you would do that, I finally found my book, is this right here. I'm just going to step up here. I'll roll back here in a minute. And so as you can see, if I can hold this still and keep the picture clear, along the top line here is a list of medications, and then down the side is another list of medications. And so what you're going to do is you're going to find the medication along the top and medication along the side, and then wherever your fingers come together, you look in that little particular square there, and it will usually have like a Y for yes, they are compatible, N for no, they're not compatible. This particular book has C in there, that they are compatible, or an I, that they are incompatible. If there is no information in there at all, so like the box is white, then they don't know, or research has not been done, or not enough research has been done. So then you're going to want to call down to your pharmacist and ask the pharmacist if you can in fact mix those 2 medications together. All right, set back up here. Okay, so then another thing that you want to make sure that you do is ask about allergies. Check in the patient's chart, confirm whether they have any allergies to this medication or not, but then also when you get into the patient's room, you want to make sure that you ask the patient, are they allergic to anything that you know of. Okay, so then one other thing before I talk about the supplies that you're going to need is I want to show you this little prop that I made up here. And so you also want to go in and check the IV. So here's my primary IV is running into my patient here. And I want to make sure that I look here again for those signs and symptoms of phlebitis or infiltration. Again, we already talked about those, but just to briefly summarize those, remember phlebitis is going to be extremely painful. The patient will be complaining of a lot of pain. They will want it stopped for sure. It'll most likely be reddened area around here with red streak running up that vein. That is that vein inflaming and becoming irritated. If you palpate it, it's very tender to touch and very hard. Also where it's turning red, so you've got a color change there, it's hot to the touch. So it's red, it's hard, it's hot, it's running a streak up through there, and it's extremely painful to the patient. Whereas infiltration is going to be just directly the opposite of that. That's where the IV has perforated through the vein. May have been because the patient moved their arm a certain way, rolled over, done something, and caused it to perforate through the vein. And so the solution from the primary IV is actually running and going into the patient's tissue instead of into the vein. That's going to make a lump start to appear. It becomes uncomfortable, so the patient will be complaining that the IV is starting to hurt. It's becoming uncomfortable. Something is wrong, but it'll have a white look to it. It'll be puffy. It'll be cool to the touch because it's actually solution running through this line, so the air around that line is cooling that solution off, and so it's actually cool to the touch. So totally opposite things. So you do want to look at that before you hook anything up and start running anything. All right, and so then the next thing that we got to do is we're going to look at our supplies that we need. If I'm not going to be down here at the IV site, okay, remember this would have an op site over it as well. So I really can't come in contact with blood as long as I'm just looking for signs and symptoms of infiltration and phlebitis. So I don't have to have gloves on for this skill. Now, if my intention is that I am going to be working down here, pulling on this, checking this, anything like that, and then there is the potential for me to come in contact with blood or body fluid, then I'm going to have gloves on. But I'm not going to do that. I'm just assessing for those signs and symptoms. So, and then the rest of my work is going to be up here, really. All right, so supplies that I have to have, obviously your medicine, and you're going to do all your safety checks. Then we have to have a secondary IV line. And how do I know I have a secondary IV line? Is because it says secondary IV. Okay, and so I'm going to move this over here. And so another way that you can tell is if you look here, okay, this is my primary IV line, and they're really long. They're about like 72 inches long. Let me go this way. So that's a big long mess. All right, that's primary line. And my secondary line is rather short. So it's like maybe 4 foot, 3 foot, 3.5, 4 foot long. Okay, and so what I want to do first thing is when I get this out, all IV tubings come wide open. They all come wide open. So before you spike your bag or anything, you always want to do the first thing. When you get your IV tubing out, no matter what kind of tubing it is, you want to shut off the regulator valve. Turn it off, because if you don't and you spike the bag, the solution is just going to take off running and come out and get you all wet, and you're going to waste this patient's medication, and we don't want to do that. So you want to make sure every IV tubing, no matter what, that you close the regulator off. Okay, so also in that kit comes the extension hanger, and I will show you what that's for in a minute, but it kind of looks just like that, and it's an extension hanger. And then we want an alcohol prep pad or two, to do this job. This is actually pretty simple to do, the actual skill. So the main thing is do all those safety checks first, make sure it's compatible, make sure the patient doesn't have an allergy to it, that you know what rate you're going to set it at. Usually primary IV rates are slow. They're going to be 12 drops per minute, something like that, whereas a Piggy Back is going to run in within 20 minutes. So it's going to have to be, if this is 50, 100 milliliters, you're going to have a pretty rapid drip to get it to drip in at 20 minutes, 30 minutes, 45 minutes, whatever. These primaries are going to be 8 hours, 10 hours, 12 hours, 24 hours, something like that. So that's going to have a fast drip rate, so you're going to need to do some calculation on that. But having said that, we are going to go ahead and get our skill done here. So what I'm going to do first is I'm going to take off my spike, and let me just show you again. This has a plastic cap on the spike, and so you're just going to pull that off, and when you pull that off, that is a sterile area right there, and so we don't want to touch that. So always keep your fingers, your thumb and your finger, behind the little wings there, I call it. And then we have our IV Piggy Back, which one side says add and one side says set, and so this is for the IV set, tubing set. So we're going to pop that one off. And once I do that, I don't want to touch that area right there because, again, that is a sterile area. So I'm going to go ahead and bring these two sterile ends together, and I'm going to just push that in there. Okay, now remember, I've already closed off my regulator, so once I turn this up, none of the solution can start running through there until I get ready for it. Okay, so what I'm going to do is I'm going to show you how to back flush the IV. This is pretty much unique to Southeast Community College Nursing Program. I was shown how to do it this way years ago, and I've passed it on to all of my students. So we're going to back flush the air out of this tubing. So remember, this tubing has air in it, and we cannot let the air go into our patient. It would kill him. That would be an air embolism, and it would kill him. So we have to purge this air out of this line. So what I'm going to do is I'm going to take my cap off here, and I just usually hold it in my hand in case I need it for anything later, so I don't throw it down right away. And I'm going to make sure that I don't touch this end right here because that is a sterile end right there. So that's all sterile, and so we don't want to touch that at all. All right, and so then the next thing that I want to do is I want to clean my port. So this is what's called a clave port. This is the clave port system. And so I'm just going to clean that off really, really well. And once I do that, I'm going to just pop that on there. Okay? And so I'm not going to use my cap. Nothing happened that I had to hang that up or anything like that. So what I have now is my secondary IV tubing is now hooked into my primary IV tubing, just like that. And so what I'm going to do is take my secondary tubing, all right, and let me go this way with that. And so I want you to watch if I can get this to work with this camera. And so I'm going to open up my secondary regulator, and as you can see, let me slow that down a little bit. As you can see, the air bubbles are starting to come back up through there. So what's happening is I am literally pulling the primary IV solution over into the secondary IV tubing and back flushing the air. And here, I know you probably can't see that, but right there is my solution coming in there. I'm just running it really slow. You can do this really quick, really fast, but I'm just running it slow so you can see it. And run a little faster now. And so I'm back flushing all the air up into the drip chamber and then up into the bag where it is safe and not going to harm anything. And so if you can see, the solution is actually rising up into the drip chamber. And I'll get it about halfway up the drip chamber, and I'm going to stop it right there, and that allows me to see my drops running in this thing, and right there is my solution. So what I did is just basically opened the secondary regulator, hold it down. It's got to kind of have a little bit of gravity to it, so hold it down, and then it will literally just start pulling the primary solution fluid into the line and back flush all the air in here. And remember, it's okay because we checked compatibility, so we can mix them. If we couldn't mix them, we wouldn't be hanging it anyway. So then I'm going to hang my secondary up here. Then what I want to do with my extension hanger is I'm going to take my primary and just put it down on the hook. There we go. And lower it down. So being as this is gravity fed, this is going to be lower, so less gravity will pull off of this bag. This is going to be higher, so more gravity will pull off of this bag. So it will get this one started first, and this one will shut off. So once I start to set the regulation or the rate on this, what I want to happen is I want my primary solution to stop running, and I want the secondary to start running and run until it is completely empty. And then what will happen is once this secondary is empty, the primary will kick back in and start running again. So I want you to notice right here, we'll just look at this for a second. Hopefully you can see the drips. There was one, and there was another. And so you can see that in the primary drip chamber, the drips, there was another one, are really slow rate. All right, and so this is going to need to run at a much faster rate. So watch what I do here to get that to happen. I have two regulators. I have one regulator, okay, that is the secondary regulator, and I'm going to open it wide open, okay? So once I open it wide open, okay, then I've got this regulator, okay, so as you can see, this one is starting to run. Okay, there's a drop. There's another drop right there. Okay, so it's starting to run, my secondary. And you can see down here that the primary has stopped running. And that's what I want it to do, because I want this to run in now. This is the medication that I need to go into the patient now. Okay, but it's still running at a very slow rate because it has to go through the primary regulator, which is this one. This is my secondary regulator. I've opened it wide open to let the solution run through this, but it comes down here and meets this one here. Okay, so what I have to do is open this one, the primary, up a little bit more to get this one to run a little bit faster. And so I'm going to do that, and as you can see, okay, the drips are coming out pretty rapid now. Okay, and so I'm going to do that and let that run in 20 minutes, 30 minutes, whatever the doctor's order was for this solution to run in. So if you'll notice, while this one was running, again, there's nothing running out of my primary bag, and that's what I want. If we get too much fluid going into our patient at one time, it's going to cause fluid volume overload. They're going to start, the fluid will start seeping into the lungs. They'll start getting crackles, and then you're going to have a problem. So we're just going to run one at a time in. Now, I'm really going to speed this up because I do want to show you what happens, so bear with me. And I'm going to try to run this up really, really super fast here, which you would not do in your patient. But I do want to show you that once one starts to empty, when this bag gets empty, the other one will start to run. Okay, so just keep watching. So you can see here, this one's still running, the secondary, and the primary is not doing anything. And we're just about done. Okay, and it's empty. So you can see this one has stopped running now. Okay, and so what we anticipate is that as soon as all the rest of that is still running out of the line here a little bit. And now you can see here that our primary has started back. So our secondary is empty now. There's nothing competing here. There's no gravity pulling here. So this one, our primary, starts to run. But if you look, how fast is that running? Okay, so again, this primary now is running at the rate we had the secondary. We had that set for the secondary. So you've got to be in there at the correct time to slow the primary rate back down. So I'm going to get my primary regulator and I'm just going to slow it back down to the rate that the doctor ordered. Okay? And so now my primary is running again, slowed down at the rate the doctor ordered. And so hopefully that will help you learn how to do that. And so they've just hollered at me that I have a Skype meeting. So I'm going to load this up for you. It will be on my YouTube account, and I will send you the link to that, and you can watch this over and over and over.